Hi, I'm Heather MacLean. I went to medical school at Dalhousie University, and I'm currently the pre-clerkship director at the University of Ottawa for the Anglophone stream. And I am the leader of the Mindfulness curriculum. I came across mindfulness meditation quite by accident, and unlike other people who often find mindfulness when they're going through a period of distress or a very difficult period in their life, I had found mine during a relatively smooth, quiet period in my life, and I stumbled across it in a bookstore actually. I found a Oprah book club book at the bookstore, and I thought, well, if Oprah liked this book, I probably would too. And it was titled A New Earth, Finding Your Life's Purpose by Eckhart Tolle. And I had no idea what this book was about, but I bought it thinking it was an Oprah book club book. And I started leafing through the first chapter. And I remember one of the lines in the first chapter said something to the effect of, this book will either change your life or it will be meaningless. And up to that point, I wasn't sure which one it was going to be. In fact, I was quite skeptical that I might actually fall in the latter group of those two choices. But as I started reading on, and I was reading more of chapter 2 and chapter 3, the author very eloquently started to describe the current state of humanity and how humans basically are hijacked by their own thoughts and emotions, and we live almost entirely in our own head, and we really only relate to each other and to the world around us through a sort of distorted lens of our own thoughts. And as a neurologist, which I am, this really rang true to me, because I thought, gee, I think I actually live most of my life in my head too. And I found this kind of disturbing because I started wondering, am I really using my brain? Am I really using my mind? Or is my mind using me? And in his book, he had some tips on how to drop into the present moment and step away from your own mind chatter so that it wasn't forefront in your life. And I realized when I did that all of a sudden I could relate to people around me and the world around me with a little bit of space and clarity, and it actually gave me some peace. I find that mindfulness has helped me as a physician a lot of times in patient encounters when there may or may not actually be a cure for somebody. For instance, it's not uncommon for me to be in clinic and be 10 or 15 minutes behind, and so I'll be with a patient and my brain is already thinking about the next patient I've got to see, and that I can't get behind time, and my pager might be going off, but I'm sort of projecting myself into the future, and I'm really not with that patient in that moment. And it's during those times that I use mindfulness to put the brakes on that and just drop into the present moment and think to myself, how can I really help this patient? What does this patient need of me right now? And especially in those that might have either a disorder that doesn't have a treatment, or sometimes that we can't diagnose. And I'm remembering a patient specifically in the past few weeks that came to me with a long list of physical complaints. It was 3 pages, and more than that, she hadn't really felt listened to. And normally when you see a patient that comes in with 3 pages of symptoms, what often a doctor is trained to do is say, well, let's talk about the 3 most important ones. Let's pick 3 and we'll talk about those and try and figure out where to go from here. But I knew just looking at this patient, if I wasn't thinking about the rest of my clinic or the clinic that just happened before that, that what she really needed to do was meet for her to listen to her. And so I did. I sat, I listened to every single physical symptom that she had listed on her list. A lot of times I'd just nod and listen, and other times I'd ask her a few pertinent questions related to the symptom that she was having. But what was most important was that she actually got through her entire list. And even though I didn't have a medical diagnosis for her, and I was able to explain that to her, and I didn't really have a treatment for her per se, when she got to the list, she finished it and she sort of held it up and flipped it over, and she kind of looked at me like, I can't believe I got through my list. And she visibly looked lighter. She looked like a weight had been taken off her shoulders. And even though I hadn't done a lick in terms of treating her or figuring out what was going on, she thanked me for listening, and she actually was helped by this. And that I found very, very rewarding. So after many years teaching at the University of Ottawa, before I even became pre-clerkship director, I could see how stressed the students were. And I don't think it's just our students, it's students in general. And I remember being stressed as a medical student, so I could empathize with our students. But I really wanted to help. And I could see that a lot of the stress and pain the students would be going through, especially in the pre-exam period, wasn't always completely related to what they were experiencing. A lot of it actually had to do with their thoughts about the experience that they were having. And I wondered whether mindfulness might be able to help them not get rid of that stress necessarily, but to relate to that stress differently, which does actually improve your stress level because you're not hijacked by that stress anymore. So when I interviewed for the job as pre-clerkship director, they asked me what changes I'd want to make, and I said, well, at the risk of not being hired, what I want to do is I want to add in an element of spirituality to the medical curriculum, and by way of mindfulness. And they hired me, so I knew that that was a go. But really my goal was just to help the students find or be exposed to mindfulness as a self-care technique that might actually help them not only during their medical school, but set up a foundation for them as they went on through residency and then becoming practicing physicians in their own right. The most rewarding part of the mindfulness curriculum to me has been that in the past 2 years, because we implemented the curriculum back in the fall of 2014, but there's been a handful of students each year that have either emailed me or called me and left voicemails on my answering machine, or grabbed me in the hallway and said, thank you so much for introducing this to me. I'd never been exposed to mindfulness before, and this literally has changed my life. My vision for the mindfulness curriculum over the next 2 years is that all students that enter the University of Ottawa medical school, the undergraduate curriculum, be exposed to the concept of mindfulness as a self-care technique and become comfortable in terms of its concepts and its practice. Whether they want to practice it themselves is totally up to them, and it depends on whether or not mindfulness resonates with them personally. If it does, they can use this as a self-care tool, and if it doesn't resonate with them now, it may in the future, and they may also be able to recommend it to patients who are perhaps experiencing chronic anxiety or stress or ailments like chronic pain, in which mindfulness can actually be a therapeutic tool. Like exercise for the brain, it's developing new pathways that lead to reduced stress, increased empathy, and increased resilience. Treat the whole person, but in order to do so, you have to be a whole person. That beliefs are are just more thoughts, and thoughts themselves may or may not be based in reality. So it's okay to have beliefs, but probably not wise to be too invested in them. I put my attention immediately into my hands, and once my awareness is there, I feel a little bit of tingling. I've dropped into the present moment, dropped out of the mind chatter in my head, and I'm able to proceed. That mindfulness meditation was about trying to stop your thoughts. It's not about trying to stop your thoughts, it's about stepping back from your thoughts and creating some space around them. To start off with an informal mindfulness practice, just dropping into the present moment for brief moments at a time. And after that, they can start with more formal meditation practice. But my biggest suggestion is to just do it and see what happens.